Hi guys, in this video I'm going to explain why I want you to view your return to running as strength training for the Achilles tendon instead of just thinking of it as running training. So my name is Maryke, I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video, link to our website is in there. Excellent, so what am I on about? Why do I need you to focus on return to running as strength training rather than return to running, just running? Well, first of all, consider this. When you run, forces of up to 6 to 8 times your body weight goes through your Achilles tendon and your calf. Now, what have you been doing with your heel raises? A lot of people just do body weight stuff, so 3 times 15. We tend to load our patients up that they get to about 10 to 20% of their body weight, some even a little bit heavier depending on what they want to be doing. But even if you've trained with really heavy weights on your back, it's still not 6 to 8 times your body weight that you trained with. So running is a massive increase in strength training or force that's going through that Achilles tendon. And if you do too much too quickly, the tendon won't be able to cope with it and the injury will come back to an extent. It'll become more sensitive again. So you need to kind of think of it as strength training rather than running, because the problem is also that your cardiovascular system will adapt really quickly and it'll say, come on now, we can run faster. Come on now, we can run further. I'm okay. Look at my heart rate. My heart rate's pretty good. Heart rate cannot tell you anything about how your Achilles tendon is doing. Also, your muscles may be pretty fit, and if you've cross-trained, they'll be ready to go as well. But again, that can't tell you anything about how happy that Achilles tendon is to accept the load. But don't worry, there's a way that you can introduce running that will strengthen your Achilles tendon and cause it to not overstrain. So if we think of return to running for Achilles patients, we tend to use a run-walk program for most of them, especially if you've had a break from running. If you've continued running in the meantime, brilliant, then you wouldn't have to start from scratch because you've already got that certain amount of strength in that Achilles tendon. But you would still have to be quite careful with how you ramp up your intensity and stuff, and I'll get to that in a minute. So we tend to get our patients back with run-walk programs so that you do 1 minute run, 1 minute walk, sometimes more running versus walking. It depends on the patient and your specific circumstances. Now, what that 1 minute or few minutes of walking in between the run sections does is it just allows the tendon and the muscles and everything, even the nerves, to just recover, have a bit of a rest so that they're ready for the next run section. Whereas if you just do a continuous run, you may get to the point where you've depleted all the energy and that tissue has now reached the end of its endurance, and that's when the pain recurs. So it's much better to do a run-walk program where you allow little bits of rest in between, because you can usually end up doing a bigger volume of running but without overstepping the mark there. Think of it in the same terms as when you do regular strength training in the gym. You'll do a set, then you'll have a minute or two's rest. Then you'll do another set. If you just continue to try do all your reps in one go, you'll fatigue and you won't be able to continue, and you may even strain something. And it's exactly the same concept when you get back to running. Now, you've gone through your run-walk program and you can do continuous running. When we think of the forces created through the Achilles tendon when we run, fast running creates much, much larger forces than slow running. Also, the longer you run for, of course, the more the tissue will fatigue. And then also, if we think of fast running, really high intensity fast running versus just slightly faster running is again more force through the tendon. So we've got to take all of these things into consideration when you think of your comeback from running or from injury. First thing to think about is build your base mileage. You have got to get a decent volume of just base endurance mileage in your Achilles tendon and your legs before you can think about speed. And that usually takes, depending on the patient again and your fitness level at that point, anything between 6 to 8 weeks. Of course, it will be different if you are somebody who just likes to run shorter distances like easy 5Ks, 10Ks versus somebody who does endurance training. Person who does the shorter distances won't have to train to the same volumes as the person having to build the endurance up to the higher volumes. Now, you also have to think about the frequency when you run. So if you are just getting back to running, that Achilles tendon will not be well trained yet, and it will take longer to recover. As it recovers and gets stronger, gets used to running, it will need less recovery time. So initially it's better to leave 1 to 2 days between your runs. Whereas later on, when you've about 5-6 weeks into your training program, you can likely do back-to-back runs. But again, it depends on your specific case. So frequency at the beginning, space them out. And as you get further into your rehab, you can have back-to-back runs very likely. Then when we start adding in speed sessions, the Achilles tend to tolerate tempo runs where you just increase the speed a little bit above your normal slow pace running or easy run pace for a set period of time and then bring it back down. That type of strength training or run training is usually tolerated better by the Achilles tendon and allows for that strength adaptations that we need for fast running. Again, think of the frequency of that in your week, because if you're doing faster running, it'll be higher forces, so you need a bit more recovery time. And preferably only have one faster run session in the week or harder run session initially when you start adding them in. Also, just keep in mind that if before you were injured, you were doing your tempo runs at this pace, it may not be a good idea, or it very likely isn't a good idea to just jump in with that pace. You need to build it up to that pace. So initially it may mean that you just increase your pace above your normal easy run pace by 30 seconds or minute max, something like that, that you really ease into that speed training. Now, once you're happy with your tempo runs and you've done that for a while, then you can think about adding in hill runs. Because again, running up a hill and running fast up a hill, I'm not talking about easy runs up a hill. You should be able, if you're doing tempo runs and things, you should be able to do hills within your normal, regular, easy runs already. But I'm talking about a proper hill session where you're sprinting up a hill. That's a much larger load again on the Achilles tendon. So only start adding that in once you're happy with your tempo runs. And same thing for track sessions. Track sessions where you're running full out is really high load, and people tend to cope with them better if you leave them and slowly introduce them later on. But again, not going into full out track sessions, but maybe ease over a period of 3-4 weeks from running at 80% intensity, maybe 90% intensity a week or so later, so that you build up to your 100% efforts. And also make sure that you schedule those track sessions, that you don't run on tired legs, that you start with a fresh tendon, fresh calves, that you can perform at your best. Excellent. Let me know if you've got any questions. And if you need more help with an injury, you're always welcome to consult one of us via video call. Link to the website is in the description of this video. Take care.